Good morning, it's Dr. Garrett, and I am here in the great outdoors again. So today I want to talk to you about what blood pressure is and why having high blood pressure can cause some problems in your body. So to begin with, let's talk about what is blood pressure, how do we start measuring it, all of this good stuff. So our first blood pressure cuff was actually created back in the early 1800s, and they were trying to figure out, what does this mean? What does this do? How do we figure out what kind of effects and what correlation do we have on the body with these numbers? At that time, it was just a tool, something to pull out of a box and say, oh yeah, let's check your blood pressure. However, fast forward a little bit, let's talk about President Roosevelt. Now, when President Roosevelt was in office, this is when blood pressure started becoming a really big thing because he had documented blood pressures while in office at a baseline of 180 over 120. Now, today, any medical professionals know that this is hypertensive urgency, hypertensive emergency, or possibly hypertensive crisis, depending on some additional factors. However, before he died, his last documented blood pressure was 300 over 210. So if you think about that for a minute, he died shortly after that reading. But if you think about that, that tells you that that's a big thing. So what is our normals? Our normals are less than 120, less than 80. So what are we talking about here? We're talking about systolic, which is the first number, and diastolic, which is the bottom number. Systolic is when the heart is actively pumping and contracting. Diastolic is when the heart is relaxing and resting. So we use these two numbers to tell us how the heart is working and what kind of pressure is coming out. Now, we've got a couple baroreceptors located in the aortic arch, the vessel that comes out of the heart, and within our carotid sinuses. If the pressure against that is too much, then our body says, whoa, 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 Sparky, let's calm it on down. Now, if there's not enough stretch against those arterial baroreceptors, the body then says, hey, we need to increase our blood pressures. So how does that happen? Through a complex chemical reaction within the body. So where does it all start? Our liver spits out this thing called angiotensinogen. Now, angiotensinogen is nothing on its own, just kind of circulates there. However, if pressures are low, the kidneys are going to spit out renin. Now, renin meets up with angiotensinogen and becomes angiotensin 1. Now, angiotensin 1 circulates through the body, meets up with our angiotensin converting enzyme from the lungs and creates angiotensin 2. Now, angiotensin 2 is very potent, and it does a couple different things. It works on the adrenal glands, these little glands on the back of the kidneys, and what it does is it stimulates the release of a chemical hormone known as aldosterone. Now, aldosterone does two different things. It will cause constriction of those blood vessels. So if we clamp down on that, the pressure going through the tube is going to be higher. It also works in the kidneys to tell the body to, hey, hang on to sodium. Now we know that wherever salt goes, water follows. So if we are hanging on to sodium, then we're going to hang on to water, which is going to increase our volume, which will cause our pressures to go up. So what does this mean for you? Our systolic number, the one we want less than 120, that again is when the heart is squeezing. That one is more correlated with cardiovascular mortality or morbidity, death, than any other number. So what happens if your pressures are high? And what causes those pressures to be high? Well, eating a high salty diet can cause those pressures to be high. Remember, wherever salt goes, water follows. Eating a fatty diet with a lot of cholesterol will cause plaques to lay up alongside the arteries, creating a more narrow chamber, essentially creating a fake squeeze down, which will cause the pressures to be higher. Now, stress causes circulating catecholamines to be released from the body tissues, which will cause the pressures to be higher. Ibuprofen works within the kidneys to keep the renin production abnormally high. that renin production is abnormally high, then your pressures will be up. So there are a lot of things that cause this. So what do we do to decrease our blood pressures? A couple different things. So typically we talk about TLCs, therapeutic lifestyle changes. We want you to lose some weight. If you lose about 5 to 10 kilograms, then you will drop your systolic pressure by about 20 points. If you give up salt or go less salt, so less than 1.4 grams a day, you're going to drop your pressures by about 8 to 12 points. Now, if you give up alcohol or go less, you'll drop about 2 to 4 points. If you exercise, you're going to drop your blood pressure as well by about 4 to 10 points. So these are simple things that you can do. Now there's a diet called the DASH diet, DASH. This acronym stands for Dietary Approaches to Stop Hypertension. It does what it says. So you're going to limit your red meat. That's going to decrease your cholesterol. It's going to decrease those fatty plaques within the body. You're going to increase your fruits and vegetables. This is going to help you with a whole lot of things. You know that anything that has been kissed by the sun and loved by the earth is good for your body and your overall well-being. You're going to reduce your sodium, so less than 1.25 teaspoons. I also want you to look for hidden sources of sodium. So in your sodas, in your canned goods, prepackaged meals, processed foods. So drop it to less than 1.4 grams per day. And the other thing is limit your dairy. So I've talked to you before about triglycerides and how bad they are for you. Triglycerides are an inflammatory marker found within the blood that lets us know the inflammation level of the arteries in the heart. Unfortunately, triglycerides go up when you increase your dairy and your sweets. So we need to decrease this. Now, all of these things will help bring your blood pressure down. If you consecutively have high blood pressure, though, it's important that you get started on a medication that can help temporarily lower that blood pressure so that you can live a healthier, longer life. There are so many diseases and causes and things that can come about from having high blood pressure. So the sooner you can decrease it, the better off you will be. If you have any questions, give me a call, 812-290-2128. And I hope that you have a lovely day.